So thank you for that introduction. So I'll be talking to you. Oh, first I'll introduce myself. My name's Eli. I am assistant professor here at the Vermont Center on Behavior and Health. I also did my pre-doctoral training here with John for the past 5 or so years. I'll be talking to you about an idea that started with John, and this is an adaptation of it. We are looking at characterizing electronic cigarette users or e-cigarette users who are never regular combustible tobacco smokers. And specifically, we use the population assessment of tobacco and health Wave 4 survey. So to start with, a little background. As most of you are probably aware, e-cigarette use has increased pretty dramatically in the past decade. This raises some questions about, will we get this new population of people who are addicted to non-combustible vaping or e-cigarette use, but not combustible tobacco. And there's some evidence to suggest that that group of people is increasing, although the base rate is relatively small. So a recent paper by Rodu and colleagues found 8 to 16% of e-cigarette users were never cigarette smokers. So these are exclusive e-cigarette users. Now, a really interesting paper this year came out by Wei and colleagues demonstrating that 62% of these exclusive e-cigarette users continued to be exclusive e-cigarette users at a 2-year follow-up. So maybe this is a stable group, and we might be seeing more of these over the next few years. So we aim to just describe this group of folks in comparison to dual users as well as never e-cigarette users. As I mentioned before, we use the PATH Wave 4. This was collected between 2016 and 2018, nationally representative data set. We identified over 14,000 never regular combustible tobacco smokers. And then from that sample, we described e-cigarette use and their demographic characteristics. So this cascade diagram demonstrates cross-sectionally where these e-cigarette never smokers fit into this group. So we start with a group of over 14,000 never combustible tobacco users. What we see is among those with past 30-day e-cigarette use, about a quarter ended up being regular e-cigarette users who were never combustible tobacco smokers. Another quarter ended up being experimental e-cigarette users. I'll focus on the regular users. Now, in terms of their demographic characteristics, this is an epidemiological study, so there's a lot going on here. Apologize for that. The first column is our e-cigarette never smoker group. Second column is our dual users. These are dual combustible e-cigarette users. Third column is our never e-cigarette, never combustible tobacco group. And what I want to draw your attention to is these exclusive e-cigarette users appear to be mostly mostly male, mostly young adults, mostly white, and mostly unmarried. And the bolded text indicates a difference from one of the other two groups. And so we're seeing a lot of differences on demographic variables for this e-cigarette never smoker group compared to others. Now, moving on to tobacco use characteristics. Again, this first column here is our exclusive e-cigarette users. The second column, can you all see that okay? Maybe that's a little better. The second column is our dual users. What I want to draw your attention to here is that our exclusive e-cigarette users, about 40% used daily, about 40% used within the first 30 minutes of waking, and most use e-cigarettes that contain nicotine. Also interesting to note is most are using rechargeable fruit-flavored e-cigarettes, almost none intended to quit in the next 6 months. That is, quit e-cigarettes in the next 6 months. And there was relatively little alternative tobacco use in this group in the past 30 days. There still is some, so about 30% smoked at least one cigarette in the past 30 days, but this is significantly less on most tobacco characteristics than our dual users, which is to be expected. So broad 1,000-foot view here. What we found here is that most adult US e-cigarette never smokers appear to be mostly white, young adult, unmarried men, and they mostly appear to be using refillable tank or rechargeable fruit-flavored e-cigarettes containing nicotine. Very few have plans to quit in the next 6 months, and most did not use other tobacco in the past 30 days. So this is interesting for a few reasons, one of which is this group appears to differ from dual users in a number of ways. So it appears to be this distinct group of tobacco users. And another is that very few intend to quit in the near future, which could be one explanation for that 60% who continued to use e-cigarettes at a 2-year follow-up. So all this is to say is we definitely can use more longitudinal experimental research to try to better understand exclusive e-cigarette use and what the public health implications are. And I will end there. Thanks.
Thank you, Eli. Does anybody have any questions for Eli?
Eli, do you any data about whether this group is more or less addicted than you would think?
Well, that's a great question. I guess that depends on what's your assumption? What do you think? And so, you know, here we're seeing that about 40%, so I'll zoom in here again, vape within the first 30 minutes of waking. That's about the same as dual users. The interesting thing is with dual users is they may be smoking cigarettes before they start vaping. So I think that would be an interesting next step to start to compare e-cigarette dependence between exclusive e-cigarette users and dual users.
Eli, do you know the product with which this group initiated tobacco use? What was their first? Was it a cigarette or an e-cigarette?
I don't know that, but that's a really good question. It would be interesting to see if these exclusive e-cigarette users tried something else and then transitioned to e-cigarettes, or whether they started with e-cigarettes.
Do we have any other questions? If not, we can move to the next presenter. So that would be me, I guess. So I'll get started. My name is Anthony Oliver. I am currently a postdoctoral fellow at the Vermont Center on Behavior and Health, where I primarily work with Sarah Heil and Steve Higgins. And so today I'm going to be presenting some work that I've been conducting with Steve. And the title of our project is Investigating the Substitutability of Alternative Nicotine and Tobacco Products for Conventional Cigarettes in an Experimental Tobacco Marketplace among Vulnerable Populations. And so we know that smoking rates are generally decreasing in the United States. However, there are certain segments of our population in which smoking remains prevalent and of a significant public health concern. And so these tend to be individuals residing in rural areas, and then what we term vulnerable populations, which are individuals with substance use disorders, individuals with mental illness, or socioeconomic disadvantage. And so given that smoking rates tend to be so high in these populations, it is important to understand how tobacco regulatory policies impact smoking among these populations. And so one way to do that is to model potential tobacco regulatory policies using what's called the experimental tobacco marketplace. And the experimental tobacco marketplace is this really cool experimental design in which researchers can evaluate how participants make choices when there's multiple tobacco products concurrently available. And so this allows for researchers to investigate cigarette demand and product substitutability in a more naturalistic setting. So this is not like a questionnaire. It can be set up as a questionnaire, but you actually let the participants interact with product that they want to participate or that they want to purchase and consume. And so the purpose of the current study was to experimentally model the effects of increased cigarette price on purchasing of alternative combustible and non-combustible sources of nicotine among individuals who are more at risk of tobacco addiction. And so this is an ongoing study. It was interrupted by COVID, so we're hoping to finish soon. And so far we've collected data on 19 individuals. And so these were 5 women of socioeconomic disadvantage, 9 individuals diagnosed with opioid use disorder, and 9 individuals with affective disorder. And so what we did in these sessions is we gave participants in-session spending money that was based on their weekly cigarette consumption. And so they actually were provided with money in the study. And what we did in each of these ETM sessions is we made cigarettes available at 5 different price points. So they could purchase cigarettes at 12 cents a piece, 25 cents a piece, 50 cents, $1, and $2. And there's also concurrently available other products. And these things were like Skull, Nicotine gum, Juul. And the prices for these commodities always remain the same. And so we brought people into the lab and we ran 3 different ETM sessions with those 5 different price points for cigarettes. And so our 3 sessions that we had the all products available. So they can purchase cigarettes at those 5 different price points in different sessions. And then they could also purchase things like Skull, Nicotine gum, Juul, usual brand cigarettes, Nicotine lozenges, snus, and cigarillos. In our all products except Juul, they could purchase all those products except for Juul. And then in all products except cigars, they could purchase everything except for cigarillos and like Black and Milds. And so after they finished each of these sessions, we actually actualized one of those cigarette price points. So if the person was actualized in the 12-cent cigarette condition, we would give them all the cigarettes and other products that they purchased. And so you get this really nice correspondence between a hypothetical sort of behavioral economics task and then a task in which they actually receive those products. And so down in this corner here is a picture of, if I can zoom in on it, is what this looked like. So essentially the experimental tobacco marketplace looked like almost like Amazon, where people could buy the cigarette products. And so what we ended up finding with these participants is that in all of 3 sessions, as the price of cigarettes increased, there was a decrease in their purchasing of cigarettes. And so these are these left-hand graphs in each of these conditions. So they purchased more cigarettes when they were cheaper and less cigarettes when they were more expensive. However, as cigarette prices increased in the all products condition, we saw an increase in the purchase of Juul and cigars, or cigarillos in this case. And what we actually found is running linear regression is that Juul substituted for cigarettes in these conditions, which was pretty interesting. In the no cigars condition, what we found was that Juul did not substitute for cigarettes, but Juul purchases increased as a function of increased cigarette prices. So when we ran the linear regression on this data path where my cursor is, that was not statistically significant, but we do see an increase in purchasing of those cigarettes. And then when no Juul was available, cigars did not substitute for cigarettes, but cigar purchasing did increase as a function of increased cigarette prices. And the data here look a little funky because we had an individual purchase, I think like 30 cigars in one session. So even though they had the money to do that, it kind of was an outlier in our data, and we're still collecting more data. And so just to end, the current study replicates and extends previous work with the ETM by demonstrating that this is a feasible methodology to use with vulnerable populations. We did see a decrease in cigarette purchasing as a function of price. And we actually found that Juul demonstrated the greatest substitutability of the other products. And so the concurrent availability of Juul may provide an alternative to cigarettes among rural and vulnerable populations. And with that, I am done. Does anybody have any questions?
Yeah, that was really interesting. Thanks. I'm curious to hear your thoughts, expanding this a bit on whether you think vulnerable populations, or maybe which vulnerable populations, would have more or less demand for tobacco products than non-vulnerable populations. So do you think that would you expect to see a difference based on a vulnerability? Or maybe there's some research on that. I don't know if there is.
I'm not 100% sure. It's something that I'm becoming more interested in. So with the study 2 that we've just finished with T-Cores, I want to look at urban versus rural differences in cigarette demand using the CPT. But it's something that I need to look more into. One of the things that I think could be kind of interesting is with some of these products that can substitute for cigarettes, there seems to be a barrier to entry. So like buying a Juul device is what, $40, $50. And so I'm wondering if those sort of barriers are going to also change kind of how people purchase these products and how they interact with these products in a real market situation. But I think when we look at just like cigarette demand, if we're thinking more on those behavioral economic measures, if I'm remembering correctly, our substance use population tend to have higher demand for cigarettes versus our other two populations. Roxanne, does that sound generally correct? If I'm remembering correctly, yeah, that's what we were seeing with the P2 participants is their overall consumption of cigarettes tends to be higher. So, did that answer your question?
Yeah, thanks.
Okay, cool.
Anthony, was this population poly-tobacco users, or how did you go about deciding on which alternative products to make available to them?
So we just used, essentially we used the standard, we were replicating some work that was coming out of Warren Bickel's lab. So we used the alternative products that had been used in those studies. So this was kind of an extension or a systematic replication of that work. I think as we continue to develop this, this procedure, it's something that we can tailor more to individual participants. One of the things that we did do is we had an opportunity for each of these participants to sample the products. So at the screening session, they could sample each of the Juul products so they could pick what flavor they wanted. So they could have menthol or the tobacco flavors, but they could also test and try out like the cigarillos, filtered cigars, and things like that.
Tony, if I can add on to what you were saying about study 2, I'm pretty sure with our forthcoming paper, we looked at some of the biomarkers, the urine cotinine and the NNAL, and within the smokers with opioid use disorder, we didn't see the same magnitude of reduction in those biomarkers with the different dose, the very low nicotine content cigarettes. So that might suggest that they are compensating with alternative tobacco products, which is part of what my project is looking at, and I know Steve is interested in looking at more.
All right, I guess we will move to the next presenter, which is Jess.
Okay. Can everyone see the presentation?
Yes.
Okay. So the topic is reducing harm from smokeless tobacco with tobacco-free nicotine pouches. All of my co-authors and myself are from the Battelle Memorial Institute in Baltimore, Maryland. I don't need to tell you all this basic information, but I will anyways. Smokeless tobacco is commonly used, particularly in rural areas and by youth. And its use is associated with increased risk of cancer as well as other health conditions, primarily due to components of the tobacco other than nicotine. Therefore, there's a potential to reduce the harm from smokeless tobacco use through switching to tobacco-free oral nicotine products. One example of these are tobacco-free nicotine pouches. These are products that contain nicotine in salt form combined with flavoring, sweeteners, and alkaline agents that increase the pH during use. There are 4 major brands currently in the US, as well as about 8 that are prominently marketed in Europe. In 2019, there were more than $40 million in sales, and the volume of sales seems to only have increased, with an online retailer expecting 1 million cans per month by the end of the year. So for this study, we selected 8 tobacco-free nicotine products, 2 from Drift, 3 from On, 2 from Velo, and 1 from Zyn. Nicotine was analyzed using liquid chromatography, tandem mass spectrometry, and the pH was measured using 2 different methodologies. One is a standard methodology published by the CDC and used for all smokeless tobacco products. And it consists of 2 grams of product in 20 milliliters of distilled water. And for the study, we developed an alternative methodology that uses 1 pouch in 20 milliliters of artificial saliva. So the pH that we obtained, we calculated the unionized nicotine, which is the most readily absorbed form. And here are some of the results. This is for the standardized methodology. In blue, the total nicotine, which pretty much aligned with what was on the labels. Sometimes it was a bit below, about 13%, and a little bit above, about 5%. But there was a huge variability, as you can see in the red bars, in the unionized nicotine from 17% to 74% of the total. And interestingly, some products like On Mint 2 milligram had more unionized nicotine than products that had more total nicotine like Drift Spearmint 4 milligram. In terms of pH, we also found a difference between brands manufactured in Sweden, Drift, On, Zyn, and the American brand Velo. So comparing the two different methodologies for testing pH, the artificial saliva methodology being intended to better mimic in vivo conditions, we'll find that the pH is reduced, and of course the unionized nicotine is also reduced under this alternative methodology using artificial saliva. But importantly, the variability is also increased because the products differ in their ability to resist the buffering effects of artificial saliva. And Drift tended to have the least change in pH, whereas On had the greatest. One of the consequences of this is that Drift Spearmint 7 milligrams seen here at the top, actually has 2 times the unionized nicotine under the alternative methodology as On Mint 8 milligrams, despite the fact that they have similar total nicotine content and similar unionized nicotine content under the standardized methodology. So this was the first study to chemically characterize multiple TFNP sold in the United States. The range of unionized nicotine varied from 0.3 to 3.9 milligrams, which is at the lower end of the range for American moist snuff products and overlaps with the average for American snus per gram. So though low, the unionized nicotine content of TFNPs may be offset by their higher efficiency of nicotine release. And therefore, smokeless tobacco users who switch may decrease or increase their nicotine intake depending on which products they select, their nicotine release profile, and use behaviors. So studies are needed in order to determine the acceptability of these products for harm reduction, as well as the resulting nicotine intake by users. And in addition, alternative methodologies may be needed to characterize the chemical properties in vitro that better reflect conditions in vivo. Thank you.
Great, I'd like to open it up for questions.
So it looks like it's not, there's a lot of heterogeneity across the different products, isn't there?
There is.
So you really, it's hard to lump them, isn't it?
That's one of the core messages of the manuscript we're developing now, which is this is not a homogeneous class of products. One size does not fit all, and it's important to study many different products and to understand their pharmacokinetics, their ability to be used for smoking cessation, for ST cessation. You really can't paint them all with the same brush.
And especially interesting in terms of, quote, addiction potential, if this pharmacology changes that to some extent.
Right.
Any other questions?
Just a more general question is, I know with other forms of smokeless tobacco, there can be a deterrent to initiation because of the nausea that can develop if you're not accustomed to tobacco use. Does that exist with these types of nicotine products?
The nausea associated with the nicotine definitely does exist, and I think this is one of the primary reasons that every single brand of products has at least 2 levels of nicotine. And in many cases, they differ considerably more in unionized nicotine than they do in total nicotine. So you can see that for Drift in particular and Velo to some extent. Less so for On because as the total nicotine increases, as the total nicotine for On products increases here, the increase is still pretty consistent in the unionized nicotine.
So from the manufacturer's perspective, one reason they may want to have less unionized nicotine is to increase the likelihood of initiation for people who aren't accustomed to it.
Or increase the likelihood of dual use relative to switching.
Yeah.
And for Velo, which is made by R.J. Reynolds, who also makes Camel Snus, you definitely have a lot of literature that has pointed to varying theories for the explanation, varying theories that try to explain why they're producing these products that have low unionized nicotine. And these issues have come up. Is it to try to encourage smokers to become dual users? Is it so that people have a step down product? Or is it to initiate people into smokeless tobacco use? I don't think that's a settled debate.
Thanks.
All right, Roxanne, you're up next. Thank you, Jess.
Sorry, I have to unmute myself. Can everybody see that all right?
Yes.
Okay, great. Yeah, so I'm Roxanne. I'm a third-year graduate student here at the University of Vermont. And today I'm going to be talking about a project I'm working on with our T-Core Center, looking at characterizing use of e-cigarettes in a randomized clinical trial investigating reduced nicotine content cigarettes among smokers with psychiatric conditions or socioeconomic disadvantage. So as many of you may know, research with the general population of smokers suggests that reducing the nicotine content in cigarettes to very low levels will reduce the smoking rate, nicotine dependence, and toxin exposure without substantial adverse consequences. And so our T-Core Center here at Vermont actually decided to further this research and look at the effects of very low nicotine content cigarettes in vulnerable populations, namely smokers with affective disorders, smokers with opioid use disorder, and socioeconomically disadvantaged women. So this trial, just to give you some background, just recently wrapped up and completed its analyses, but recruited 775 cigarette smokers from those 3 vulnerable populations that I just mentioned. And for 12 weeks, participants were randomly assigned to use one of 3 research cigarettes. So they were either assigned to a normal nicotine content cigarette, which is 15.8 milligrams of nicotine per gram of tobacco, or one of 2 very low nicotine content cigarettes, either a 0.4 or a 2.4 milligram per gram cigarette. And as I mentioned, they were asked to use those cigarettes for the 12-week study period. And during that 12 weeks, they used a interactive voice response system where they reported their daily use of cigarettes, how many cigarettes that they smoked each day. And so the results of that parent trial showed that total CPD at the 12-week study time point, that end point, across the populations decreased the amount of, it decreased the CPD for participants who were in the very low nicotine content cigarette conditions when compared to the smokers that were in the normal nicotine content cigarettes. So that expands and replicates the results that have been seen in the general population of smokers. However, when reducing the nicotine content of cigarettes, this could lead smokers to seek other sources of nicotine to compensate. And this might be particularly true for smokers who live in rural areas where some non-cigarette tobacco products are used more regularly than in rural areas among smokers than in urban areas. So for this secondary analysis, we wanted to start an in-depth look at use of other tobacco products among the parent trial, and we started with use of e-cigarettes. And we looked at use of e-cigarettes among these vulnerable populations and how it was associated with the effect of very low nicotine content cigarettes on total cigarette smoke per day that we observed in the parent trial. So similarly, in terms of reporting the cigarettes that they smoked per day, we asked participants in this trial to report their use of e-cigarettes on a daily basis. This was just a yes or no question. So e-cigarette use for this secondary analysis was examined as the mean number of days used per week. And for our analyses, we did a growth curve model where we looked at associations between e-cigarette use, population, assigned cigarette nicotine content, and the effect of e-cigarette use on CPD. So to get into the results, there was a subset of participants who did report use of e-cigarettes. Overall, it was very little e-cigarette use among the sample. And we found no significant main effect of e-cigarette use or interaction of e-cigarette use with their cigarette nicotine content on their total CPD. So this means that we didn't see any moderating effect of e-cigarette use that the very low nicotine content cigarettes had on their week 12 CPD. We also looked at associations between e-cigarette use and population and assigned cigarette nicotine content. And we did find a significant interaction with population and cigarette nicotine content collapsed across the time points. It's an interesting finding because you can see in the figure here, the top two panels represent the two very low nicotine content cigarette conditions, the 0.4 and the 2.4, where we didn't see any significant differences by population in terms of their e-cigarette use. However, we did find in that normal nicotine content group that smokers with opioid use disorder were more likely to report e-cigarette use. It's worth noting, though, again, that we did see very little e-cigarette use overall. So those smokers with opioid use disorder in that normal nicotine content group were only reporting about 0.18 days per week on average of e-cigarette use. So overall, very few participants used e-cigarettes during the study. We found no evidence that e-cigarette use moderated the effect that very low nicotine content cigarettes had on reducing total CPD in these vulnerable populations. And while there's a significant difference in e-cigarette use among these smokers with opioid use disorder, it's unclear how clinically significant this is given that the frequency of e-cigarette use across all three populations and cigarette conditions was very low. However, it is possible that participants are using other forms of nicotine besides e-cigarettes, and so additional analyses focused on other tobacco products like smokeless tobacco or nicotine replacement therapy are warranted.
Thank you, Roxanne. Does anybody have any questions for Roxanne?
I do. Hi, Roxanne.
Hi, Maria.
Do you know how common e-cigarette use is in Vermont in general? Like, is it surprising considering the use in Vermont, or is it? Yeah, that's my question.
I'm not positive. That's a good question. This sample, Maria, you know, is Vermont and Baltimore because it's JHU, and yeah. Rhode Island from Brown. So it'd be interesting to look at e-cigarette use in those 3 places and how this compares, and if there's any data of e-cigarette use among vulnerable populations. I know, I don't know of the literature in that area, but maybe Eli knows more about Vermont e-cigarette use. Not to call you out, Eli, sorry.
That's something I probably should know. I don't know the prevalence in Vermont. Maybe I'll pass the buck to John. John, do you know the prevalence of e-cigarette use in Vermont?
No, but on a sort of a different note, when you have a very weak independent variable here, one way around this is to look at the extremes. So one possibility is just grab the people that are the very high end and the very low end. They're self-selected groups, of course, but at least you can. If you don't see an effect there, you're probably not going to see an effect.
Well, one other question I had related to that, the total cigarettes per day, that's study cigarettes and non-study cigarettes, is that right?
Yeah, yes, that's non-study cigarettes and study cigarettes, yep.
So I wonder if, in addition to looking at the extreme ends, if you just looked at the people who were very adherent or, a cutoff of say 90% or 75% to these non-study cigarettes who actually did reduce their nicotine from combustible cigarettes, and maybe you might see more e-cigarette use among those folks as opposed to those who were very non-compliant or found it very unacceptable to transition to the low nicotine combustible cigarettes.
Yeah, that's a really good thought. We're working on additional analyses for this topic, and so that's something to definitely look into. Thanks for sharing.
Yeah, I think that's a really interesting point, Eli, is just kind of looking at them at a function of, how adherent they were. Mm-hmm. Really be worth looking at, I think. Do we have any other questions for Roxanne? All right, we can open it up to general questions then about any of the products, or not products, sorry, any of the presentations. If anybody has any other additional questions. I have a question about the tobacco-free alternative nicotine products, Jess. How widely used are those products? Are you?
So there's no data.
Okay.
Other than sales, and that was the source that I cited for 2019, and that hasn't been published. It's only a webinar, so personal communication. If you take the projections of this website seriously, that sells a lot of products, particularly during COVID, online, they're expecting 1 million a month. A heavy user would probably use 5 a week, so 20. Divide 1 million by 20, you get about 50,000. You can say that's very low, but there's still a lot of convenience store sales. I would say minimum 100,000 users at a heavy level, and probably additional. John, you've worked with Zyn and Swedish Match. Do you have numbers that aren't public?
Yeah, let me think what I can say here. So first of all, I do consult with Swedish Match. Most of the people that are using the Zyn are smokeless users. So they're not getting never users, or they're not getting tobacco users. But that's limited because when they did the study, the place where they put the ads for the Zyn was next to the smokeless products, okay? But even so, I think that's who's going to be using these. It's going to be used mostly, besides dual use and just avoiding restrictions. In terms of therapeutic use, I don't think we're going to be able to get, it's going to be very interesting to see if we can get never smokers or tobacco smokers to use this, because if it was in Sweden, I would say it's a no dump. It would happen. But Sweden's different than the U.S. So I don't know. But I think most of the use is going to be among smokeless users who want to quit or reduce.
That's interesting. The reason why I asked is I see a lot of ads for them on the internet for Zyn in particular. So I was just wondering kind of how prevalent it is. And I think,
well, every convenience store in a 2-mile radius of my house has at least one product. Most have 2 or 3.
Wow.
On the other hand, despite that retail prevalence, cashiers know nothing about them. So, you know, when I was buying the samples, I had to basically point and almost go behind the counter because they had no idea what I was asking for. So clearly there's an effort to put these products on the shelves.
Yeah.
I don't know if that's being followed up with actual sales.
Yeah. Eli, are those data in PATH? Like, do they ask about use of those sort of products in PATH?
Oh gosh, that's a great question.
Because I know they used to have.
No, they don't. They're too new. They're not in PATH yet.
Okay. Yeah, I wasn't sure if they were like wave, because they just came out with wave 4, correct?
I mean, part of it, to me, when I saw the first sales data for the Zen, I was shocked, because if you think about what's so different about Zen versus nicotine tablets or nicotine, the other products, and why would, I mean, they're both just have nicotine but don't have anything else in them.
Mm-hmm.
And I think that some of it is this advertising. You know, it's white, it's clean. The advertising is talking about, you know, it is acting as if this is a very safe product there. And then if you don't pair it with quitting, I think once you pair your product with quitting, your sales go down.
Yeah.
If you don't pair the product with quitting, you can sell more.
Interesting.
And Zyn is the market leader. Almost 90% of sales in the US are of Zyn. I found that out after we picked our products, but the reality is that they had first mover advantage in the US. They came in 2016 nationwide, and a lot of the other products have been more recent.
Awesome, thank you. Does anybody have any other questions? All right, well, thank you all for presenting. They're very interesting talks, and that is it for our session. Thank you.
Thanks.
Bye-bye.
Bye.
Thanks.